All right, guys, so Trev here's having a little bit of front shoulder pain. After doing some tests, we isolated that the pain specifically on the front is likely coming from the long head of his bicep tendon. So this muscle right here, its tendon goes under the deltoid and attaches onto the front, into the front of the shoulder right here. Also has a little bit of shoulder blade instability, probably serratus anterior, lower trap, as well as a little bit of overuse of his infraspinatus on the back side. So thankfully we're catching it pretty early, so we're going to start with some Graston techniques, some myofascial scraping, and then follow it up with some pin and stretching. It's going to be oodles of fun, right, Trev?
Yeah.
Yeah.
Great.
Yeah. All right. So let's get rocking and rolling. So borrow this arm right here, Trev. Here we go. So now with myofascial scraping, we want to make sure that we're just going at a smooth glide all the way across. That's why we're going to use some of the lotion right here and a slight angle. This shouldn't be too painful. Probably feel a little bit of Rice Krispie. Some of these spots are more sensitive, especially if we get close to bone. But overall, I like to use this tool because it helps to decrease adhesions between the skin, the subcutaneous fat layer that we all have, and then the muscle itself, because we want all those three components to glide smoothly past each other. Otherwise, we're going to get a altering of function. So if there's any kind of stickiness in there, then that's when our body essentially alters how it moves in subtle ways. But those subtle ways build up over time, over many reps. All right, so now we're just going to flip this around to make it a little bit more aggressive. Right here, again, based off my initial palpation, but also what I'm feeling with the tool. That's going to guide me where I'm really focusing my work right here. So it's seeming like it's a little bit more in the upper part of his bicep towards the shoulder, right through there, and it's a little bit covered by some of his tattoos right here, but there's a little bit of redness forming as well as a few little red spots. That is totally normal. Those spots should not be sore at all after this treatment though. All right. Cool beans. Now, we're also going to be working on the deltoid a little bit right here too, because this is usually involved as well. So yeah, let's use this right here. The deltoid can also be a little bit sensitive as well too. I'm already seeing some redness start to occur here, so that's telling me that there's probably more of that fascial adhesion on the front deltoid region instead of the bicep. So we want to make sure to treat both of those zones. All right, so now we're going to switch gears right here. We're going to do our pin and stretching. So for the bicep, because it does that elbow flexion motion, it'll be pretty simple. Right here for him, we're just going to hold firm pressure, make sure it's tolerable for Trev, and then we're just going to lengthen that arm up. Here we go. And then we'll do about 5 to 10 of these right here. Switch up the hand position. Go. Basically, this should feel sensitive, but should be pretty tolerable. Trevor should be able to stay relaxed as we do this. And so the bicep is a pretty common muscle to get irritated, especially the long head of its tendon. That outside bicep tendon can get irritated, especially for us doing a lot of overhead work. So that's why it's so important to do your prehab. Yeah, shoulder stability. All right, we're going to do one more spot right here. 5, 4, 3, 2, and 1. Yep, as you can hear from Trev, that's a pretty gnarly spot right here. I can also feel that there's a bit more adhesion on that, so we're actually going to spend a little bit more time here. I'm just going to lock in right there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. There we go. Trev's being a champ about this. There we go. He's holding in there. All right, we're going to get some of the deltoid right here. It's going to be a bit more sensitive. We're going to use this kind of that broad surface of the fist. Hold for 5, 4, 3, 2, 1. Then we're going to change our vector. This is going to be a little bit gnarlier. 5, 4, 3, 2, 1. And lastly, we're going to do some pin and stretching for that deltoid. So the deltoid does a lot of internal rotation as well as bringing that arm over. So that's what we'll be using right here. So we're going to pin it just right there, and we're going to rotate out. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and one more, and 10. There we go. All right, so that was some soft tissue work for Trev, really hardcore athlete with some front shoulder pain right here. Irritation, again, is probably from the long head of the biceps.